Hello my younglings, and today is your adrenal gland video. We are going to cover your adrenal glands and then finish up the endocrine system in this video. So hang tight, and here we go. Okay. So your adrenal glands can be a little bit complicated, I'm not going to lie to you. However, I would highly recommend, if you are going to pick and choose what you study the most and commit to memory the most for remembering beyond the test, as opposed to studying for a test, know your adrenal glands and know some of the hormones that come out of them, simply because it will affect a number of things, right? One of the hormones we are going to be talking about today is called aldosterone, and it is one of the key hormones that controls your blood pressure. And it controls your blood pressure by controlling your kidneys, or kidney function, and it comes from your adrenal glands. And because of that, not only are you learning about aldosterone and can it be brought up in your Unit 1 exam because this is your endocrine system from your adrenal glands, but in your Unit 2 exam, when we talk about your cardiovascular system, blood pressure disorders, the heart, that sort of thing, and we get into your blood vessels, aldosterone will also, or can also be mentioned. And in your, I believe, Unit 4 exam, when we get to the urinary system, because aldosterone controls kidney output, it can be mentioned there. So simply by the nature of this one hormone and its location and where it's made in the body, and its job, it can be brought up across 3 different units. Because of that, it is also quite likely that such a hormone will be mentioned on your collective final exam, right? Because it's a topic that hits on 3 different unit exams. So please do not skimp on studying aldosterone above all things. But now that I have that preface out of the way, we're going to be talking about your adrenal glands. The adrenal glands are the little pyramid-shaped glands that are on top of your kidneys. They can be shaped like a little pyramid paper hat if you want to think of them that way. So they are the little bitty hats on top of your kidneys. They are shaped like a pyramid. Because they are above your kidneys or on top of your kidneys, they can also be referred to as the suprarenal glands. If you see the word renal in something, it means it is pertaining to your kidneys. Supra means above, so above your kidney glands, right? That is the fancier term for your adrenal glands. Most people just refer to them as your adrenals. And if we were to cut your adrenal glands in half, there is a meatier outer part to the gland, which is called the cortex, and then a stringier, lighter middle part of the gland, which is called a medulla. That is a common theme in anatomy and physiology. If you don't have me for lab and haven't heard me say that before, a number of your organs have a lighter, stringier middle part and a meatier outer part. So the meatier outer part is always referred to as a cortex. The stringier middle, lighter part is always referred to as the medulla. In addition to your adrenal glands having this, so do your kidneys, your lymph nodes, a number of other structures within your organs and glands, like the lobules within your thymus. Generally speaking, those are your 2 basic terms for those components. Outer meatier part is the cortex, the inner lighter part is the medulla. Those 2 terms are not going to go away anytime throughout anatomy, so just learn them now. Right, so the adrenal medulla the medulla for our adrenal gland has more nervous tissue in its center, and it acts as part of your sympathetic nervous system, if you guys remember from A&P1 when you talked about your nervous system. Most of the glandular tissue, though, is the cortex of your adrenal gland. Right? The cortex itself has multiple layers, so your kidney or your adrenal glands can get somewhat complicated because that cortex has multiple layers that all have different jobs, if that makes sense. So there are 5 total layers going down from outside of your adrenal gland down into your medulla, and they each produce a different type of hormone or have a different job, right? The outermost layer is a protective covering on your adrenal gland called the capsule. Its job is just to hold things together and be the protective covering. The next layer down is called the zona glomerulosa, and I know that looks like a terribly weird word, but it's called the zona glomerulosa because that zone produces mineralocorticoid hormones, aldosterone being the main one of them, and aldosterone controls a part of your kidney called the glomerulus, which is a major part of the filtration of your kidneys. You guys have never heard that term before, more than likely, especially considering your urinary system is not until further into the semester. Just know that this zone is named because of the part of the kidney it controls, so the name does make sense. You just haven't covered the kidneys yet. And they interact with one another. So aldosterone is made by the zona glomerulosa, and that zone makes other aldosterone and other mineralocorticoids. The next zone going down has slightly more structured cells instead of like a little circular layer, and it is called the zona fasciculata, and the zona fasciculata makes a type of hormone called glucocorticoids, your main example of which would be I apologize. Your main example of which would be cortisol. Cortisol reduces inflammation and inflammatory response and makes itching stop. You can buy cortisol or cortisol-containing creams over the counter from your drugstore or at Walmart, and it's usually what you're putting on your arm if you get poison ivy and that kind of thing, because it does reduce inflammation and it cuts down on swelling and itching. Right? So that is naturally made within your body to handle situations such as that by the zona fasciculata. The next layer down is probably the least structured of the layers, and it is called the zona reticularis. Your zona reticularis makes a set of hormones called gonatocorticoids. They are hormones such as androgens. They are additional hormones that will affect your gonads and can be converted into reproductive system hormones. We'll talk about those in a minute. And then the middle part, once again, it is your adrenal medulla, and in addition to working with your sympathetic nervous system, it is also responsible for making epinephrine and norepinephrine, which are the 2 hormones, as you guys know, that are responsible for your fight or flight response or your adrenaline rush. Your adrenaline rush comes from your adrenal glands, and it comes from the adrenal medulla because that's what makes epinephrine and norepinephrine in your body. Right? So we're going to jump right in and talk about aldosterone first because it is in that first layer of your kidney. And this is probably one of the more complex mechanisms that we are going to discuss. So mineralocorticoids are the hormones or corticoids in your body that will control your mineral levels within your bloodstream or your body. I know it's kind of weird to call them mineral levels because we tend to think about minerals as rocks, but realistically, that's exactly what sodium and potassium are. They are fancy broken down minerals or rocks that we need in our bodies to function. And as you guys will remember from Anatomy and Physiology 1, your nerves and your muscle cells and other such things function on a sodium-potassium pump, and your body strives to maintain a balanced ratio of sodium and potassium within it so that everything goes off without a hitch and everything can easily do its job and run smoothly, right? So the most abundant cation, or positive ion, within your extracellular fluid, or ECF, as I've probably abbreviated on your note-taking guides when I'm typing quickly, is in fact sodium. You guys know how important sodium is to your body and how many things it can do. Sodium affects a great deal of things, right? Sodium can affect the volume of your extracellular fluid in the first place, your blood volume, so how thick your blood is as it's pumping, which then will also affect your blood pressure, which is why one of the first things doctors will tell people when you start to have a high blood pressure would be to cut down on your salt a little bit, and that's why people with heart conditions also need to cut down on their salt. And your sodium ion levels can also indicate or impact other ion levels in your body, right? We know the importance of potassium in your body as well, because the two try to or need to remain in balance. Potassium within your body also sets your resting membrane potential of all of your cells. So that is like the reset mechanism for your cells, or the membranes around your cells, to just reset before they begin doing an additional process. So it sets the resting membrane potential of your cells, and it's needed as that even trade or ratioed trade for sodium-potassium pumps, so your nerves can fire off their signals, and so your muscles can additionally constrict and contract. So potassium is also needed in a certain balance and ratio with sodium so that your other systems in your body can function. The simple, straightforward job of aldosterone as a mineralocorticoid is to regulate these mineralocorticoids, or is to regulate these minerals within your body to maintain homeostasis. Essentially, aldosterone is going to stimulate reabsorption of salt back into your body when your salt levels go low or your sodium levels go low. And help with water retention from your kidneys, and it's going to eliminate excess potassium from your blood. That is the job of aldosterone. And you have a few different mechanisms in your body that everything is gathering information from and detecting so that your body can maintain this and maintain its level of aldosterone. So you have a number of different mechanisms here that impact all of this, right? So the primary regulators, or the first things your body prioritizes information from, is the renin-angiotensin mechanism. We're going to talk a little bit more about that in a minute, but essentially, for this mechanism, your renin and angiotensin mechanism is what your body uses as the forefront to decrease your blood pressure. Right? So this is the first thing your body does when your body majorly detects that you have high blood pressure. It is going to stimulate your kidneys to release a hormone called renin. And renin, when it is released, is going to trigger the formation of something called angiotensin II, which is then going to stimulate aldosterone to be released from your adrenal glands. So once aldosterone or angiotensin II has told your adrenal glands in the zona glomerulosa to release aldosterone, the aldosterone itself is then going to tell your kidneys to absorb more sodium from the waste your kidneys are filtering out, and let more potassium go through, be filtered out of your blood. And that in return, right? In return, that's going to allow your blood volume and blood pressure, because you've just increased your sodium, to increase or rise. Because remember, sodium makes your blood pressure and all of the space or volume of your extracellular fluid and your blood increase. So aldosterone is going to make all of this go up because your body told it to release renin and angiotensin. Okay. So that is all triggered when your body detects that you have a decrease in blood volume or blood pressure. So if you've been in a car accident and you are bleeding out and your kidneys detect that your blood pressure or blood volume is lowering, there you go. If you just lose blood pressure rather quickly. Your kidneys will detect that, and it will begin this renin-angiotensin mechanism to release aldosterone to make your blood pressure or blood volume go up. Right? Another thing that will affect your blood pressure and affect all of this is your body also has other mechanisms in it that are not your kidneys that just straight up detect the concentration of potassium in your blood. So when your body detects that you have too much potassium in your blood flow, it sends that signal directly to your zona glomerulosa so that your body can magically then begin to produce and make aldosterone. And aldosterone is going to tell your body to get rid of all that extra potassium and keep more sodium, get rid of more potassium. That itself is going to cause your blood pressure and your blood volume to rise once again, because that's the job of aldosterone. But your body wants to get rid of that excess potassium, because if you have far too much potassium in your body, it can cause you to have a heart attack because your heart muscles will begin to spasm. So your body specifically detects this, and when numbers get too high, automatically sends a signal to the zona glomerulosa. You make aldosterone. Your body or the aldosterone makes your kidneys kick out or excrete more potassium. You keep more sodium to balance it out, and then your blood pressure and blood volume go back up to where it should be. Right? The third mechanism your body has for all of this, right? It comes from your pituitary that we've already covered in the form of a hormone called ACTH, or adrenal corticotropic hormone. Adrenocorticotropic hormone that comes from your anterior pituitary is released during times of stress. You guys have all been stressed out before. We all know that stress will make your blood pressure go up. This is how stress makes your blood pressure go up. So when you are stressed out, your anterior pituitary begins making this your anticorticotropic hormone, or adrenocorticotropic hormone, your ACTH, sends the signal down to your zona glomerulosa. There you go. Which then begins making your aldosterone. You guys know the end result of this. Your blood pressure is going to go up. This is how stress affects your blood pressure going up. Right? And then the one thing and the one mechanism in your body that will have the opposite effect of everything you need to do. Right? Your heart muscle cells also detect blood pressure, which makes sense. Your heart is the pump for your blood. And it detects if your blood pressure is already high or too much. Your heart itself will begin making a little bitty hormone called your atrial natriuretic peptide. Atrial, because of the atrium of the heart. We'll get to that in a different video if you don't know your heart anatomy yet. Natriuretic, if you ever see something that starts with natriu, like this weird kind of suffix-prefix thing, that is the Latin term for salt or sodium, and it's why your chemical signal for sodium is an Na, because that is the Latin, French, and other language-based words for salt. It was just deemed a natural mineral, so they named it after such. So this is your atrial natriuretic peptide, meaning it's a protein from your atrium that deals with your salt levels. And it is released, this ANP is released, when your blood pressure and your blood volume have gone up and your heart detects that. ANP, though, inhibit messages going to your zona glomerulosa, and essentially it's going to block renin and aldosterone from being secreted, because your heart's desire is to decrease your blood pressure, because it's releasing this because it detected that your blood pressure is too high. Okay? So essentially, ANP, when it is released, it halts some of this other function, and it will make you urinate out sodium in your urine. So you're getting rid of the extra sodium. This ANP mechanism and factor that inhibits aldosterone is the only one of these 4 factors that we have discussed that actively make your blood pressure go down. Right? The job of aldosterone at the end of the day is to make your blood pressure go back up, because more things in nature, before we had modern technology and things got a little bit we got too comfortable because we no longer have to hunt and gather. We have our grocery stores and our refrigerators and such. Biology has not caught up to our lifestyles. And more things, if we are camping and just out in nature, cause you to have lower blood pressure than high blood pressure. That is sort of a disease of luxury and technology, if you will. So our bodies are better equipped and designed to deal with blood pressure falling and lower blood pressure than it is for sustained high blood pressure like we have in our modern society as a health concern. So aldosterone's job is to raise your blood volume or your blood pressure, and the only thing that inhibits it is this ANP, and that will make your blood pressure go down. Right? So essentially, if we are going to draw arrows for this renin-angiotensin mechanism here, because that is the main one that will control aldosterone, your body's going to sense a decrease in blood pressure. It's then your kidneys from there are going to create this protein hormone called renin. Renin is then going to create something called angiotensin, or angiotensin 2, because you have a few variations of that in your body. Angiotensin 2 is what interacts with the zona glomerulosa of your adrenal cortex, because remember, your adrenal gland is sitting right on top of your kidney. This message does not have to go far at all. Right? So angiotensin 2 tells your body, make aldosterone. You make the aldosterone, sodium levels go up, potassium goes down, blood pressure goes up. Aldosterone, because of this, is also a very potent vasoconstrictor. Part of what aldosterone does is it makes your arteries and your blood vessels tighten up, which is how it helps your blood pressure rise and go up. All of this can increase your blood pressure, and this is based on a negative feedback mechanism. So when your body detects that your blood pressure is fine again, it stops producing the renin, and it stops controlling this mechanism to raise your blood pressure when it feels like your blood pressure is high enough again. If, however, you're talking about your grandparents or your parents, maybe you, depending on how old you are as my student, if you've gone to the doctor and the doctor has told you, you have high blood pressure, we need to fix this. One of the first medications they will put you on is called an ACE inhibitor. And what an ACE inhibitor does is it inhibits or cuts off this communication right here where my mouse is between angiotensin 2 and aldosterone. And because the ACE inhibitor cuts off that communication at the quick right there, it means that your body will not produce more aldosterone, so you're going to continue to urinate as normally, and you're going to release the sodium and other such things. And because it's making you urinate out the excess water along with that sodium, your blood pressure will go down. That is normally one of the most basic and first blood pressure medications the doctors will put you on. My mother and father, when they were both on theirs, because the older you get, the more likely it is you're probably going to be put on some blood pressure medication. My mother called it her pee pill because it makes you have to use the restroom all the time, because it makes your kidneys continue to filter, meaning you have more water going through you. It used to drive my mom up the wall because my dad would refuse to take his blood pressure medication on important days like the Super Bowl, because he didn't want to have to be getting up from his chair and going back and forth to the bathroom all day long, because he wanted to sit there and watch the Super Bowl. So he would refuse to take his blood pressure medication on days like the Super Bowl, like Super Bowl Sunday. To each their own. Sometimes in your life and throughout working in healthcare, you will meet stubborn older people as well. A couple of disorders to remember from this aldosterone stuff, right? Hypersecretion, meaning you secrete too much of it. If you are secreting too much aldosterone because of a tumor on your adrenal glands, that is called aldosteronism. Hypertension and edema are going to be the results of this, meaning you're going to have high blood pressure, because if you're over secreting the hormone that makes your blood pressure go up, your blood pressure is going to go up, right? And swelling or edema, because your body has all that excess fluid in it from the sodium, are going to be side effects of this. Eventually, if that gets too bad, if it gets worse and worse, you're going to have an out of whack proportion of this potassium and sodium, and you'll have way too much potassium. And if you have too much potassium in your body, that can lead to really weird abnormal bodily functions of like your nerves and your muscles, because having too much potassium will cause random spasms of your muscles and your nerves. And at that point in time, you definitely need to go to the doctor and have things fixed and looked at so you don't overdose on it and give yourself a heart attack. But that would be what aldosteronism is. I know that was a lot for just the one hormone and the one layer of your adrenal gland, but we have a few more to go. Fortunately, they are not as in-depth. Right? So your glucocorticoids are the next ones down your list, right? Your glucocorticoids, their job as a basic job is to keep blood sugar levels relatively constant, right? So they help your pancreas, and they work with your pancreas and insulin and whatnot to help even out and maintain your levels of blood sugar. Cortisol is the most significant glucocorticoid and hormone that controls this. Cortisol is released in response to ACTH, or adrenal corticotropic hormone, from your pituitary. And that's going to pattern your eating activity and stress levels and that sort of thing. So that's going to affect your cortisol levels, which will then impact your blood sugar levels. This is also your cortisol also has a primary metabolic effect on gluconeogenesis, or your body's ability to form new sugars out of fats and proteins that it breaks down. Gluco, sugar, new, genesis, creation. So gluconeogenesis is the process by which your body is breaking down other things to create sugars, like it breaks down fats and proteins. And cortisol is also going to promote a rise in your blood glucose levels, fatty acids, and your amino acids, because it just broke down a bunch of proteins and fats, so you're going to have the leftover pieces floating around your system because of that. So that's everything that cortisol does for your body. Right? There are a couple of diseases and disorders that come with cortisol and this layer of your adrenal gland, however. The first one is hypersecretion, meaning you are making far too much cortisol. And hypersecretion from your adrenal gland of cortisol is called Cushing's disease or Cushing's syndrome. Right? So Cushing's syndrome does a few things to your body. Right? It will depress your cartilage and bone formation. So it will throw some things out of whack, and that means you're going to have a dramatic loss of muscle and bone protein, so your bones are not going to be as strong. This inhibits inflammation, so you're not going to have that strong of... It will weaken your immune system, essentially. So it's going to depress your immune system. It also promotes changes in your cardiovascular and your neural and gastrointestinal functions. Other side effects of Cushing's syndrome, because it makes you gain weight in weird places because you are breaking down fat and rebuilding things in odd places of your body, it tends to make you have a rounder face, or called moon face. Your body will start storing fat at the base of your neck on the back, which will give you a sort of humped back that is called a buffalo hump. You're going to have weird abdominal weight gain as well, because your body will start to produce or to structure where it's storing your fat in odd places. So in addition to the rounder face and the buffalo hump, you're going to have abdominal weight gain. But because of your decreased and diminished immune system and your body's, like, you're swelling because you have high blood pressure with this, you're going to retain some water. Because of all this, it also means that you're going to bruise easily. So you will start bruising easily. You'll have lowered immune system. As you gain weight asymmetrically and weirdly, you'll start gaining stretch marks. It can also have a side effect of hirsutism, which means you'll start growing odd facial hair, which is definitely weird, especially for a lady. But that would be Cushing's syndrome. Odd weight gain, buffalo hump, easily bruised, that kind of thing. Right? On the flip side of things, hyposecretion, meaning you are not secreting enough cortisol, you are lacking in cortisol production and such. Hyposecretion is Addison's disease. Addison's disease means you are not making enough of your glucocorticoids and your mineralocorticoids. Because of this, you're going to have a decrease in blood sugar and blood sodium levels, right? That can lead to some very nasty side effects. You're going to be dehydrated a great deal because, remember, your kidneys, because of the decrease in mineralocorticoids, are going to be overworking. So you're going to be urinating a lot. So you are likely going to be dehydrated. You're going to feel thirsty a great deal because your body wants to regain that liquid. You're going to lose a lot of weight because your body is doing weird things with cortisol and cannot handle blood sugar levels. So you're going to lose a lot of weight, you're going to be severely dehydrated, and because of all of this, you're also going to have hypotension, which is low blood pressure. So your blood pressure is going to be low and stay low. And an odd side effect of all of this as well, right, is your skin is going to begin to take on a bronze sort of coloration. So you're going to have a bronzing of the skin because your body won't be able to absorb keratin. Keratin is a protein that's found in things like carrots and whatnot. And keratin is, keratin is sort of important for some things, but because your body won't be able to absorb it appropriately and deal with it well, you're just going to end up with having slightly bronzed skin, oddly enough. And your potassium levels will also go up. So this needs to go to a doctor. They will need to address your low blood pressure, and they will help you and give you medicine to help with the Addison's disease. Right. So, the next one we're going to talk about briefly are your gonadoccorticoids, or your sex hormones. We know that most of our sex hormones come from our testes or our ovaries, because the testes make a great deal of testosterone, our ovaries make a great deal of estrogens, but before the onset of puberty, before those glands and organs have fully woken up to do their job, everybody has that zona reticularis in their adrenal glands, and your body is functioning based upon something called gonadoccorticoids. Gonadoccorticoids are the adrenal sex hormones. They are sex hormones produced by your adrenal gland. Most gonadoccorticoids are weak androgens. An androgen is a weak male sex hormone. But your body tissues and your cells can convert an androgen into something like testosterone. And if your body needs it, your body will convert some of those into estrogens, because androgens can be converted into either estrogens, or testosterones, based upon what your body needs. So before puberty, these hormones are what's making all of the testosterones and estrogens in your body, because your body still needs a little bit of testosterone and estrogen in it to do the secondary jobs of those hormones. Testosterone helps you build muscle mass, and all little kids want to grow up big and strong and need to build muscle mass, for example. So your 5-year-old, their testosterone mostly is coming from these androgens. Right? So when you go into puberty, at the onset of puberty, what gets your main organs, the ovaries and the testes, kick-started, and what helps them begin to develop, are these gonatocorticoids. So they're going to help, when your body reaches puberty, they are going to help the main organ responsible for your secondary sex characteristics get into gear and begin starting up, essentially. These androgens can also help your other normal sex hormones, testosterone and estrogens, because they convert into them. They can help with your appearance of your secondary sexual characteristics. That means you're widening hips and breast tissue for ladies, you're the broadening of your shoulders and muscles and deepening of your voices for our gentlemen. Androgens will help contribute to that formation. Androgens in ladies are also more potent and one of our main sources of testosterone, and help give us our sex drive because they convert into testosterone within us. And yes, ladies do indeed have a sex drive, because that would be absolutely terrible for the species if half of your species did not want to procreate. Biology fixes that. Also, when ladies have stopped our reproductive cycles and we have reached menopause, androgens will also begin converting in higher quantities into estrogens to replace the estrogen we are no longer getting from our ovaries after menopause. So androgens they do a great deal. They help balance things. It's sort of what they do, right? And then we talk about the middle, right? The middle of your adrenal glands, that medulla. So the adrenal medulla has a type of cell inside it called chromaffin cells, and chromaffin cells secrete both epinephrine and norepinephrine. Proportionally, they secrete about 80% epinephrine and 20% norepinephrine. Those two hormones, epinephrine and norepinephrine, right? They cause your blood glucose levels to rise. Remember, these are the hormones that are responsible for your fight or flight response. So they are getting you ready to either fight something for your life or run for your life. So they are going to cause a burst in blood glucose levels because you're going to need energy to either fight or run. They are going to increase your blood pressure because you're going to need the blood flowing and your heart pumping in order to get the oxygen and all that excess sugar to where you need it to be, because you're about to either run or fight. So your heart's going to also beat faster. And it is going to cause your blood to divert to your major organ systems like your brain, your heart, and your skeletal muscles. So it's sort of going to pause the blood flow to things like your digestive system, and make sure that it has prioritized the organ systems you indeed will need in order to fight or run, which would be your skeletal muscles and your brain power and your circulatory system. That's what epinephrine does. This is why you give somebody an EpiPen shot if they're having an allergic reaction, because it causes their body to go into fight or flight mode, which opens the airways and makes sure you keep your blood pressure high. And if you are having an allergic reaction and you're going into anaphylactic shock, it means that your body is panicking, essentially, and closing off your airways so that you stop being exposed to the thing you are allergic to. So giving someone a shot of epinephrine during an allergic reaction causes those airways to open back up and your body to go into fight or flight response. That being said, epinephrine you can get as a prescription in the event of allergic reactions, and it is cheaper than an EpiPen. I would like you to know this for your own health choices and options in life. When you buy an EpiPen, and the reason why EpiPens are so expensive is because you are paying for the delivery method of the epinephrine into your body, not the epinephrine itself. So you are paying a company for the EpiPen because the EpiPen is a convenient method of giving yourself the epi shot, because you can just stab yourself in the leg with it, and that's convenient for small children. However, if you are an adult and you don't want to afford your EpiPen, you can have your doctor rewrite you the prescription to just give yourself a shot of epinephrine, and that can be given to you with the prescription for probably around $10 with a needle at the pharmacist. Some people do not want to have to give themselves a shot or rely on that. The EpiPen is more convenient to use, and it is easier for a layman to find in your purse and use it on you if you are allergic to that wasp and you get stung one day out in the park. But weigh the pros and cons of things. There are alternative options, but that's why EpiPens themselves are so expensive. It's the delivery method, not the epinephrine inside it. Excuse me. Alrighty, ladies and gentlemen, so we have that was your objective number 14. All of that was objective 14, and your endocrine system, which was list and describe the effects of your adrenal hormones. The last 4 objectives we are going to briefly touch on. We can go through quickly, because they are not that bad. Name and describe the effects of the heart hormone is objective 18. We just went over that. That was your atrial natriuretic peptide. An atrial natriuretic peptide is the one hormone we have discussed that decreases the amount of sodium in your extracellular fluid and increases your blood pressure. Right? That is the only one we've discussed and talked about that did that. Endocrine Objective 19 is state the location and function of your enteroendocrine cells. Entero means within the intestines. So enteroendocrine cells that we haven't really talked about much but exist are the hormone secreting cells inside your intestines, and that's all you need to know about that for right now. Endocrine Objective 20 is describe the hormonal functions of your kidney, skin, adipose tissue, bones, and thymus. Very quickly. So your kidneys secrete a couple other hormones, and we will talk about this one in your next video quite, decently. It's called erythropoietin. Erythropoietin is the hormone that your kidneys send to your bone marrow, which make you produce more red blood cells. And it also makes you produce something called calcitrol, which is going to make calcium, and renin is another hormone that we have discussed today that helps regulate your blood pressure. Your skin is going to make something called calciferol, which is different than calcitrol. So your kidneys make calcitrol, and your skin makes calciferol. And calciferol will help your body make calcitrol. So your skin will also help make this calcitrol stuff. Your adipose or fat tissue within your body secrete a hormone called leptin, and leptin is going to help regulate fatty tissue storage. Resistin is another hormone that your fatty tissue can make, which is going to help make bad cholesterol within your body. And then your fatty tissue also makes a different hormone, which is slightly odd, called TNFA, which helps your body prevent cancer. So you need a little bit of fatty tissue in you for this, right? Your bones, your actual bone cells, can help make estrogen, which is your primary sex steroid in females. And estrogen also helps to give bone strength, and other androgens is what your bones will make. So estrogen is good for bone strength as well. And your bones will also help with growth hormone. right? You need big, strong bones. You need to grow from there, from the growth plates, that kind of thing. So your bones can secrete a little bit of those hormones. The thymus is a gland that's going to produce something called thymopoietin and thymosin. And all of that has to do with your immune system and controlling your immune cells, because your thymus is one of the places responsible for your immune system. Endocrine Objective 22 is discuss how the aging process affects endocrine system function. Just like with all things in life, most of your endocrine organs operate smoothly until you get old, so until you have hit the elderly ages. Aging, like with everything, may alter the rate of hormone secretion because your body slows down as you age. Things aren't going to go as quickly. It's going to affect breakdown and excretion from your glands, or it's going to potentially affect how sensitive your target cell receptors are. Meaning some parts of your body may no longer be as sensitive to some hormones as they once were, so those hormones will not have as strong of an effect on them. These kind of things can also be compounded or affected by chronic illnesses that are common in old age, and the more chronic illnesses an individual has from being elderly, the more this will affect how the endocrine system is no longer processing things or breaking down or secreting slowly, that kind of thing. Just your typical aging stuff. Right? And from there, we are done with your endocrine system. I hope you guys have a wonderful day, and I hope I've helped to make your adrenal gland a little bit more understandable. Until the next video, thank you very much, guys.